Hello, thank you for joining us. My name is Rhiannon Rasmussen.
I'm Rocio Garcia. We are CNLs for the Emergency and Trauma Services Departments at University Hospital for University Health, San Antonio, Texas. Early in February, when the pandemic began, we knew that we had to start planning at the leadership level. We knew it was imperative that we use a strategic approach and understood the importance of communication and preparation.
Confidence in our multidisciplinary teams and our trainings as CNL helped us to prepare for this complex and ever-evolving situation. By continuously improving our processes and applying evidence-based practices that became available.
We used PDSA cycling to be able to put processes into place to be able to take good care of our team and our community. We used PDSA cycles for things such as decontamination training, donning and doffing, and establishing a stoplight tool to communicate with our staff.
The stoplight tool was used to provide communication as far as products that were being implemented, new tools that were being released, and updates on things like PPE availability.
As the weeks went on and more evidence became available, we were able to redesign the ED and physically split the ED into a respiratory and not respiratory hallways. We did things like make a standard approach for our PPE stations so that everyone would have quick access to the PPE that they needed.
We stripped our rooms down to the basics and moved everything outside. We developed intubation kits, post-intubation kits, and split our charge nurse roles up to be able to tackle all areas of our departments, to include pediatrics, adults, and trauma.
It became evident that we had to have more treatment spaces. We used a tent external to our emergency department and created 32 additional treatment spaces. We used the PDSA cycles to drill and make sure that safe practices were established.
When the second surge hit in the summer, we had to redesign our interior spaces again in order to provide appropriate treatment spaces and proper care. We designed 38 new treatment spaces in a COVID power pod area and a regular power pod area.
We feel that our training and education and knowledge as CNLs helped us prepare for our timely response to the pandemic.
I'm proud of my CNL training. It really helped us to be prepared for what was going to happen, use our tools for leadership, communication, evidence, to openly talk with our staff, openly communicate with our team members, and to be able to provide the best care we could during these times.
We are proud of our team and the care provided to each other and our community. And thank you for the opportunity.